Hello and welcome to another episode of the Preceptorship Podcast. Today we are welcoming a preceptee, well, an old preceptee because you're finished now, from MPFT, and you're a PEDS physio. So please introduce yourself, your profession and where and when you qualified.
Thank you for having me. And my name's Ryan Hodgkinson. So I'm a PEDS physio in Staffordshire under MPFT. So I qualified last year, 2023. So I studied during COVID times, that sort of 2020, 2023. But yeah, I work on the paediatrics team.
Oh, lovely. And it's always a really interesting story to hear what led people on their kind of path to becoming an AHP. So tell us a little bit about what led you to becoming a physio.
Well, I've always worked with children. So since I was 16, I worked as like a poolside helper and a swimming teacher. I've done that for almost 13 years, really. And I've always enjoyed working with children. And I was a gym instructor as well when I left school. So I'd always been interested in health and fitness, but I'd never really thought about doing physio or anything like that. At which point I did my degree in sport and exercise sciences, and I found a really big interest in cardiac rehab. So I was working as an exercise physiologist for a charity, but under as like a band 5 exercise physiologist. I was there for almost 6 years, at which point we'd sort of been doing different things like COPD rehab. There's people coming in with stroke. There's people coming in with lots of different health conditions, mainly heart conditions. And at which point we started having students from Wolverhampton University as physios. So the first physio that we actually had, he was sort of telling me about like the lots of different areas that they work in, and it really piqued my interest. I still keep in contact with him now, and we sort of check in because it's quite fun now to sort of go like, oh, I've experienced this, and we're like, oh gosh, because he used to work for the NHS. Actually, when I was on placement with Wolverhampton Uni, I would see him because he was working at New Cross. So I was like, oh, hello Jacob, how are you doing?
Oh, that's so well.
Yeah, small world.
Yeah.
But he sort of convinced me, he was like, look, you work in respiratory, you work in heart. So look, I'm doing a placement in cardiac rehab, you work in MSK. At which point I'd done things like sports massage and I was interested in all those areas. I thought, actually, this is like a good way to knit all those skills together. So I decided sort of 2020, I had a chat with my now wife, and my family, and sort of said, I think I'm going to go and do my physio degree and I'm going to re-qualify. So because of COVID, all my job at the time had gone quite telephone based and I'm more of a practical person. So it was nice to I went, right, I want to be more practical. I think I want to work on the wards. So when I did this, I wanted to work in MSK. So I just made the change over from there, really.
Oh, well, thank you, Jacob, for obviously promoting the profession and really, showing you how you can knit all those skills together. If you're listening, Jacob, thanks.
I'll have to tell him.
Yeah, it's a name drop.
Yeah.
And it's like you connected the dots, isn't it? Like you figured out what you really enjoyed, you liked working with children and you liked that hands-on and you kind of like that rehab side of things. So it's kind of like it was all meant to be.
Yeah. I'd never really thought about I'd always thought, PEDS physio looks really fun and really interesting. And I was never really thought of a way to knit physio and working with children together until really the opportunity came up, the job came up, and I thought, oh gosh, this is a nice way to knit those two things together, really. And I sort of just went for it and sort of sat in that interview and said, done lots of swimming teaching, I haven't done a paediatrics placement, but I'm really interested in doing this. And luckily, they gave me the opportunity, and now I've been there for almost a year and a half now. So.
Yeah, so on that kind of like first post, we always like to talk to preceptees, especially if we have newly qualified and new preceptees listening. We just like to talk about and normalise those emotions that happen in your first post. So how were you feeling? Were you feeling kind of anxious but at the same time really excited? Or kind of just talk us through that first post and those first like couple of weeks or couple of months.
Yeah, I think because when I was studying I didn't have any paediatrics placement. They're few and thin. Like I had some people in the course that really wanted to work in paediatrics and they didn't have a single paediatrics placement. We're not taught much about paediatrics within the physio degree. So a lot of it was, the team really building my knowledge within paediatrics. I think a lot of the sort of skills that you need in terms of paediatrics is mainly coming from your communication. Luckily, I'd had lots with not only children, but also parents and managing their expectations through swimming. But I went into it quite nervous, really, thinking, what am I going to see? And as well, when you go into your first position, lots of people are sort of saying to you, oh, you're going into a static post. Why aren't you rotating? Do you see what you want to do? And I think I didn't realise it, but paediatrics is kind of like doing a rotation all the time.
Yes.
Because your first patient could be knee pain for a 14-year-old, and then your next patient can be, a 3-month-old with plagioccephaly or talipes or something like that. So you're constantly seeing different patients. You can see MSK neuro. I work on a community, like home visits. I do special schools. I go into schools. I go into clinics. So there's so much variety. And I think it's kept me really active. And I feel like even though I'm not rotating, I'm constantly rotating with the type of patients that I'm seeing. So that's really helped to build my confidence in terms of, at first I was thinking, should I be doing a rotation? But actually now I'm rotating constantly, and it's giving me lots of skills. Yeah, so initially nervous, now I'm a lot more comfortable. I feel a lot better about what's going to come through the door. I've got a really supported team that if I'm ever going, oh my gosh, I think I need help with this and I need a bit more support, I can just message them, and my supervisor's quite willing to come and do sessions with me and give me some backup. So yeah.
I must say you do have a really lovely team.
Yeah. Even from the outside, we can tell that you have really good support network, and you have other band 5s in your team, and I think that makes such a difference of where you're talking about there, like it's kind of unusual for physios not to go into rotational posts as band 5, so it's quite interesting that you say that, and it's really nice that you've kind of reframed that, because peds, it is so varied. It is, like you said, like a little mini rotation, but just in paediatrics.
And it's, it really makes you think, doesn't it? Actually, you don't know who's going to come through the door, and there's so much variety of age in peds, isn't there? Compared to adults.
Absolutely.
There may be, 15 years difference in age between a 30 and a 45-year-old, but it's very different between a 3-month-old and a 15-year-old. So, and as we said, really great way to reframe that. I'm a physio. I didn't do my rotations. I kind of self-rotated. I moved jobs, and I had that thought of, I must rotate. I'm not doing something right because I didn't rotate. But actually that was just because all I'd heard was you should do your rotations. But you're right, you've seen such a variety. So you were talking about the support of your team, but in terms of joining preceptorship, how do you feel that preceptorship supported you going into that specialist role and as a band 5?
I think the main thing it helps you to do is to reflect on what you've seen. And I think that when you're coming into your band 5, you're thinking about, I need to get in clinic as soon as possible and see as many patients and really get some mileage and see as many people as possible. I think what preceptorship does is go, take a look at the wider picture. You're going to see lots and lots of patients, but what you're not going to do is do all the quality improvement. Think about, personal development and stuff like that, and your communication skills is a big one. And I think preceptorship just says, these are the things we want you to think about while you're going into this nice and early. And I think it sort of sets you up and goes, this isn't just a linear, see as many patients as possible. This is work on your skills, build, reflection base, and that way, in the end, it's going to equal better patient care, really, and development for yourself. So I think that preceptorship really highlights what we should be thinking about while we're actually working, but it's at a good time, because I'm not thinking about it in the future then. I'm thinking these are all skills I've already started building on.
Yeah, I think that's so important. It's like kind of like that permission to pause.
Yeah.
And as band 5s, you do see a really large caseload. And also as a band 5, you're really eager and you want to, get involved, and you want to see as many patients as possible because you want to get that experience. But if you don't have that time away to actually sit back and think, like you said, like the wider picture of things, and kind of it's like pieces of a puzzle, isn't it? And like putting it all together, because otherwise it would have just, I always say, like, it's just that first year is just incredibly, there's just so much going on. You're like a sponge and you're absorbing so much information. You've got to be able to have that time to just sit back and think, oh yeah, I did this month, this links to this. Oh yeah, I've got real strengths in this. Like, I'm sure in your communication you really identified your strengths, and then you also identify areas that you need to, maybe gaps in knowledge or develop in a little bit more. And I hope it also really enriched conversations in your supervision as well.
Absolutely.
Yeah, because it gives you topics to like talk about, or things just that maybe you wouldn't have necessarily brought up.
Yeah.
And I think what you were saying as well about it's the right time, obviously it's such a vocational career, but it is also a career. So it's really nice to have the understanding and the knowledge that you've implemented and applied those skills and you're working on them, and even just a knowledge of them, so that you may think, oh yes, okay, I'm a clinical physio at the moment, but actually, oh, that little kind of taster of QI or that taster of audits has really sparked an interest that early, so that you can be more aware of it for your career, and have that foundation very early on as well to kind of build on for the rest of your physio years.
Yeah, absolutely. I think that one of the main things that's benefited me is thinking that actually once you've completed your preceptorship, those reflections are still ones I build on now. Some of the reflections that say, what are your clinical reasons for this? Talk about this case study. Although I've submitted them and they've been signed off by my preceptor, I'm still going back to those and going, actually, like this is a difference, because I know there's 6 months and 12 months.
Yeah.
I'm now looking at them sort of, 18 months and thinking, oh, well, this has changed a lot actually now. That might have been, when I first saw them, I was like seeing them 3 or 4 times.
Yeah.
And actually now I think, actually seeing them 2 times and really reinforcing self-management, these things. And I can sort of say, look, this is how I've changed from, I probably wrote it at 3 months to now writing it at 18 months and saying, actually, this is how it's changed and how I write this.
Well, that's amazing.
That's really great to hear.
You're still, utilising it and reflecting back and showing your growth, because it's only going to continue. You're going to continue to develop. Every day is a learning day, and it's great that you're still, looking back. I think that's really important to see how far you've come, especially being in such a specialised area. So, as a band 5, you really do need to continue with that confidence building. And do you, obviously you have an incredible team, really supportive, but do you feel, because obviously the aim of preceptorship is to really help support you and retain you within your role, do you think it did, help with that kind of retention, because you really solidified, that those physio skills, and you had a really good structure for when you qualified?
Yeah, like you say, I think that obviously having a very supportive team is definitely
help.
It does help a lot. And I think that anyone that has a supportive team would probably agree, and anyone who works in my team would probably agree, actually, they put a lot of time into you and they put a lot of effort into your development, and I think that really helps. In terms of preceptorship, it helps as well because it makes you think about your development in the future, and it makes you think about these are the skills that you want to build on. And once you start reflecting on those skills, you think, oh, there's still more areas I can sort of check off and still build on, even though I'm sort of finished with preceptorship now and then moved on to beyond preceptorship. It's a case of actually, I'm still looking at those reflections and thinking, I still want to experience another time where I actually reflect on that and actually build on that same reflection. I think it definitely helps with your sort of retention within where you are, because it's just another side of development, really. And it's making you think more of the future rather than, okay, now I know how to treat that patient, that's done. It's more of a look at your quality improvement, look at how you communicate. And I think they're lifelong reflections. So I'm always going to go back to the ones I've done on preceptorship.
And also, we always say the most successful preceptees are the ones that have the most engaged and supportive preceptors. So, we've had so many band 5s now from your team complete and get through the process because your team are so passionate about that development, and so important, especially in your specialised area, because you can feel sometimes that imposter syndrome, or just completely out of your depth, especially if someone hasn't had that rotation. It's tough.
I still feel a bit imposter syndrome with stuff that I do every day. And someone will just question me, and it'll be something like a patient comes in with Osgood or Severs, and I'll be like, oh, I see this quite frequently, and then they'll ask me a question and they'll be like, what age exactly does it start? I'm just like thinking, well, skeletal when does that? And I'm like, second guessing myself. I'm like, when you're an adult and your skills and stuff, this will stop. And they're like, but when exactly? Hold on, I feel like a big girl.
Husky.
Yeah. But then there's other ones on there that I think may have done a small reflection on it, and I haven't actually used that skill again since I reflected on it. I'm still waiting for other times to sort of build on them and say, well, look, I've had another experience similar to that, and I can do that again. Yeah. And I've been really lucky having Alice, who's my preceptor, because she's now my supervisor as well.
Oh, nice.
So it was a case of, we go to clinical supervision, she'd be like, this is about your caseload, Ryan, not your perception. So let's start. And then I'd be like, but this time it's a case study, so technically no, it's on the caseload. But yeah, I probably wound Alice up a lot. Really. She'd be like, how many have you done? I've done about 8 in this last 2 weeks. She's like, oh, God. Let's go for the first one.
Love that.
I mean, obviously we can see the investment, not only from Alice, but from your team. But we appreciate that you're in a community organisation, and at times that can be isolating. Even with a supportive team, there may be times where you are on your own, and you may have met with other preceptees who are also in a community organisation that may have that feeling of isolation sometimes. Do you, in terms of the preceptorship and the access to the community, did that kind of tackle any thoughts of isolation that you may have felt at times, even if it wasn't physical isolation, but that kind of, I've got imposter syndrome and I'm not sure how others are feeling? As I say, I appreciate you've got a very supportive team, but you may have spoken to others in breakout rooms that are feeling that and shared experience with them.
Absolutely. And, we share an office with sort of speech and language. We've got dietitians over the other hallway. We've got a pad team. Speak a lot with the OTs as well. So it might just be a case of they've seen me in the meeting, in a camera, and they go, oh, you're on perceptorship as well. And, I've been doing this one. I'm struggling to find time to do this. What did you reflect on for that? Although they might be thinking, they might see a different client base, but actually I'll say, oh, well, I reflected on this treatment and this, and we'll have a Teams call about it as well, or I'll pass them on to, because I know Cameron in our team is sort of one of yours.
OGs.
So I'll just say, oh, maybe I'll chat with Cameron about that. And, the two that have finished at the same time as me, Amy and Stuart, they were both doing perceptorship at the same time, Chris as well on my team. So although we, you would call someone and go, oh, can you help me with this? Calling them and actually asking them about perceptorship sort of gives you a different angle to call them up and say, oh, I'm just doing a reflection on this. Can you have a little chat about what you reflected on for that one? So rather than sort of just constantly calling them for the same reason, but have you got time for me to shadow you? It's a case of calling them up and saying, I'm just writing my reflection on this. What did you put for, how it developed or how it helped the service user? Because I've written a reflection and actually I feel like this bit's a bit short.
Oh, that's a really nice bit of peer support. Yeah, really good peer support. And as you say, nice to kind of open those doors for other conversations. It's not just all like patient. Actually, it's reflection on situations as well. And sometimes it can be difficult to open the door to those conversations. And that, as you quite rightly say, can be quite isolating. So lovely that there's a network of preceptees and previous preceptees in your team.
So I love like clinical discussion, even if it's just, even if it's just sort of, can I have a chat with you about my clinical reason about this? I really love that discussion. It's nice when I'm in an office to do that. If I'm on a Monday where I'm on my own, I don't have someone to knock on the door and just say, oh, can I have a little chat about this? So we do call each other quite a lot, but actually when I, wasn't seeing patients and I see a green tick next to them, go, well, I'm gonna quickly call them, and they're probably thinking, here we go, professional yapper, and they're probably going to get no work done. I'm like, it's about work. It's actually about perception. So it's been good to do that, really.
Physio and
I love the enthusiasm. Like, it's so important, and like just the positive energy that you had around it. I think, it's really great to see. And then, it's in terms of the portfolio and the competencies, was there any that really stood out to you that you really enjoyed? We always like to hear kind of like standout competencies.
Yeah. I think standout ones would be things like your quality improvement, stuff like that. And actually, communication skills is always going to be a helpful one, reflecting on communication. But I think things that actually make you come out of your comfort zone, any of the reflections that make you come out of your comfort zone are the best ones, because I wouldn't have thought within the first 6 months, I'll do a quality improvement reflection, or I'll do the first steps training. I wouldn't have actually done any of those unless I'd been on preceptorship.
Yeah.
And my quality improvement was with our lower limb class, so getting teenagers to sort of, exercise in a group setting rather than like one-to-one block, or just doing exercises on your own if they were appropriate to do them. And now that's led on to further parts of my appraisal. So as part of my appraisal was, setting up the lower limb group and then auditing its effectiveness. So it's led on to my own objectives as well as being my preceptorship objectives. So it's worked really nicely.
We love that.
Anything where you sort of go out your comfort zone. I've done a talk as well during one of our staff meetings, and I probably would have not done that. And although in my mind I was thinking, I've got to reflect on this. So let's do it. I probably wouldn't have done it if I hadn't got something to push me and go, I've actually got to write something on preceptorship for this. So
it's like a supportive push in that direction,
absolutely.
isn't it? It's like, oh, okay, I'll take that leap of faith.
Yeah.
Oh, that's really lovely to hear. And we do hear that a lot, like even like with observed practice, a lot of preceptees are like, I would never have thought to ask my supervisor to come and observe me and give me written feedback.
Yeah.
And they're in teams where they can feel quite isolated as well. So it really gives permission to get involved in lots of different things because you have to.
Yeah.
And I'm really glad that has led to other things, and that's exactly what we want to hear. And it really sounds like you've got an interest in quality improvement. So
I think that, when I was chatting with our team leader, there's lots of quality improvements of actually like streamlining certain work and stuff like that. But her favourite quality improvement is things that actually help the patient. And, so I'm using an outcome measure within my treatment for low limb patients at the moment, and I'm collecting all the information about it. And in doing that, she's told me share it with the wider team. So I know that our north sort of area of our team are doing their lower limb class, it's their pilot. So I've said, use this outcome measure in your in your pilot, and actually I think it'd go really well because I used it near the end of our pilot, and it was really good. I wish I'd used it from the start, but now I use it for my clinical caseload. And I've sort of said, use it for your class, and then you can, it gives you a really nice outcome measure for the end of the class to say if it's done well.
And that's what it's all about, isn't it?
Yeah, and sharing
Getting
that
that
practice,
data.
getting the data potentially leading to an audit.
Yeah.
It's really nice to hear that you're also sharing that learning and that enthusiasm with the others as well. You may have already mentioned it, or you may not have, but if you had to pick one aspect of preceptorship that was your favourite, what would that be?
I think, like you say about the networking, I enjoyed going to the meetings, networking with other people. There's people that I used to work with. There's a dietitian actually, and I used to work at the Nuffield before I'd sort of done any of my sort of cardiac rehab stuff. Yeah. So it was I sort of said, "You're not familiar? You used to work at Nuffield with me," and they were like, "Oh gosh," So
wow,
I think that networking is just really important, and listening to other people's experience within their Band 5 roles, and actually some people that have progressed onto the Band 6 roles and saying, I'm on preceptorship, I'm looking at this and I'm doing this, and I use this reflection for a Band 6 interview. And I think that just sharing experiences and actually pulling things from your preceptorship meetings and sharing it with my wider team as well. Like, if you're sending out a video like the one about sort of empathy and stuff like that, I've shared that with a couple of people in our team and just said,
that's good.
I've never heard of empathy. And I was like, I'll send that to them, and so we can all share it. I think it's just lots of information, lots of networking, and really important way of sort of highlighting what you should be reflecting on within your first 6 to 12 months.
Yeah, you've really engaged with all of the processes, and I think I remember when we signed off Stuart as well, he'd be like, Ryan would always message me like, are you coming to the meeting? So we could really tell that you love the meetings, and you were always like so proactive, always talking in the chat, and it just makes such a difference. You really get more out of the process when you do that.
Yeah.
And it really sounds like you did.
Yeah.
And we love hearing that preceptees share our resources to their team as well.
Yeah.
So important. And just want to, obviously you're very early on with beyond preceptorship.
Yeah.
But are you enjoying that process? I know it's a little bit different, but it's kind of keeping you more keeping a structure, but it's not as structured. Yeah. But continuing that with that support, how are you finding beyond?
Yeah, good so far. If I have to admit, I haven't done a lot of work
No,
on it yet.
yeah.
The main one I sort of worked on is the sort of leadership one, following actually the meeting that we had the other day.
Yeah.
And writing on there and saying, actually, I think I can think about the goals I want to set now.
Yeah.
And, you know, things like that empathy,
Yeah.
things that I haven't heard of and I can share with the wider team. I think that it's, again, just a continuation of what preceptorship's like, but actually a bit more like grown up now. Like,
Yeah.
this is more like, you haven't got these big performers to fill out. This is totally up to you, and
Yeah.
you reflect on what you want to reflect on,
Yeah.
and you set your own goals. So I think that, you know, this is a good one as well. But yeah, I think once I'll be able to give you a bit more.
Yeah, I know,
Once
it's
I've,
still
really
early
had-
doors.
Still early doors,
Yeah.
but once I've had some time for it,
Yeah.
I think that I'll be get teeth into it and be able to feedback on it.
Yeah. Oh, exciting.
We'll have to come back and do another podcast.
Yeah. Don't bring Stuart this time.
Drag them along.
Yeah, drag him along.
So, what would your top tips be for anyone starting in their first post?
I think taking as many opportunities to shadow loads of different bits. I think, like I said earlier, when I first came in, I probably was, you know, I want to see as much clinical as possible. I'm going to shadow as many people as possible. But actually, like I said earlier, you see loads of patients and they're always going to be there. So shadow people that aren't on your team, like, you know, the OTs, the podiatrists, the dietitians. Go and shadow them and reflect on what you're seeing initially, you know, in your observations, and then when you come to apply it practically. And I think that, you know, speaking to some of our new band Python team, they're really keen to get the clinical case. I'm like, calm down, slow down. Everyone told me to slow down, and I ignored them. And now reflecting on it, I'm like, I had so much more time then to do these reflections and write these things. I think just taking lots of time to sort of reflect and develop your knowledge base within the area you moved in, especially if it's something like paediatrics. You know, we've got lots of different learning. Ask people to do some training with you. Ask people if you've got opportunities to see different things that you haven't seen yet, and just use preceptorship as a good model for the shadowing, what you should go and see, because you can sort of use the diary and the Excel sheet and say, oh, I'll get that opportunity when I go and shadow this person. Oh, I know there's a quality improvement on there. Let's sign up to that nice and early. And just get your diary full of different opportunities that are going to really highlight lots of different reflections you can do. I think that's my advice.
That's a really great top tip, because we always really encourage people to shadow people that aren't in your team or aren't your profession, or a team that you may regularly refer to. And as you say, actually getting familiar with that spreadsheet with the preceptorship kind of aims and the goals on there, you can really start to kind of tailor your diary to those opportunities. And you know, it's the real opportunity in your career to take that step back and see what others do and really absorb that knowledge. So I'm really glad that even though you maybe didn't take the advice of people to slow down, that you are spreading that message again. It was something I was very guilty of. I think we all are. As Felicity said earlier, we're just so keen to see patients. But as you just said, your caseload's always going to be there. But actually the opportunity to shadow things may not always be there. So really nice to get those booked in as much as you can.
You're sounding like a preceptor as well. You're speaking like a preceptor. Maybe that. Yeah.
Maybe I'll give it a go. You know, I think that
You absolutely should.
Yeah.
I think, you know, like you said about the ambassadors, you know, people contact you.
Yeah.
I probably would like to do something like that.
A buddy.
But I think that, you know, I've used CAM for advice, and I think actually reaching out to your own colleagues that have done preceptorship is probably the best thing first, just because they've been through the process, and they've probably, because they know you, they can sort of go, oh, well, you know, I can facilitate that opportunity for you by doing that. And, you know, I've had that with Cam, Stuart, and Chris. So I would say doing that first is probably the best thing.
Yeah.
You know, ask your colleagues, because they've done it as well.
Yeah, you can be like a preceptorship buddy now in your team.
Yeah, I'll do buddy,
Fives,
Yeah, really champion that process.
Yeah.
So I think I know the answer, but would you recommend preceptorship to another AHP?
Yeah. Yeah, absolutely. Like for the reasons I've said.
Yeah.
Networking supports your reflection skills and just generally builds your competence and your confidence within certain things. And I think it's lifelong. You know, through your career, you can keep going back to those reflections and go, look how this has changed.
Yeah.
And I think if you sort of print off reflections and you're like, that's done, and you sort of never look at it again, whereas if you keep adding to it, these give you such a good sort of framework for lots of different reflections, so you can keep building on, and you can go, oh, well, I've written on that one 5 times, I need to find an opportunity where I've written that and that's been put to the side. So I think, yeah, I definitely recommend it. That framework's just really useful.
Yeah, and now you've got your CPD portfolio, which you've really embedded because you're continuing to add to it.
Yeah.
So you've really built up that good habit, and it's great to hear that you're still continuing with that.
It's got worth because you go back to it. As you say, you don't just put it to one side and think of it as a tick box exercise. You've really put in, you've really invested in it, and that therefore it has worth to you. Yeah. And that's really great to hear.
Yeah. So, did you have any questions for us at all, or?
Yeah, I was actually, and I was going to email you to sort of prep you, but actually, I'm not going to catch it. If, out of all the, people chat to you about their competencies and reflections, you ask the question to me, what was your favourite, competency? Yeah. If you were going back and you were doing it again, what do you think your sort of favourite one would be?
I absolutely know mine, and it's one that we launched in January with the HCPC updates, and you know which one I'm going to say. And it's the impact of stress and anxiety on your own practice, because I think that we are very, very good at promoting our roles and treating our patients, but imposter syndrome, the stresses of being a band 5, the work-life balance, all of those elements, it's such a real, it can be such a stressful time in your career. If I reflect back to when I was a band 5, I relocated. I didn't have a social network where I lived. I took on a caseload. Didn't even have like a sat nav. I was just given an A to Z map. All of those stresses that I juggled. Luckily, I had a good team that helped me build my resilience. But actually, that did have an impact on me. That stress and anxiety, and I wish that I'd had the opportunity to reflect on that.
Yeah.
When I was a band 5, it's only now that I'm further in my career and I'm supporting others that I actually see if I maybe reflected more on that and implemented some maybe coping strategies. I think that my resilience would have been a bit better established. It's not that I didn't have resilience, but I think I'd been more aware of it. So I would say that's my favourite, because we're in a stressful world. Caseloads aren't getting any less, they're getting more clinically complex. And it's a real formative time in your career. So that would be mine.
Yeah, and we're getting lots of good feedback about that one. I think the other one would be quality improvement. Yeah. And I think it is because it is just getting you to think about the wider picture of things and getting you involved so early on. Like, it's not something that our team leads are just doing. Like, we can do it. Like, new band 5s can do it, and we always go on about it, don't we? Like, you're a fresh pair of eyes, and like you're super enthusiastic, and you can see things in different ways. So I really like that one, because it's really giving you permission to be like, hey, like, I've got this really good idea.
Yeah.
And you've just left uni, so you're also
fresh knowledge
that's really at the forefront. And you're right. I know we do always go on about it, that fresh set of eyes, but you may be going into a team where your team members have been there for years. So actually a process that maybe isn't as effective as it could be is done the way it is because that's the way it's done. And it just needs somebody to go, wait a minute. If we did it this way, it would be more efficient.
Yeah.
So,
Good question. I like that.
Question.
What we've added in. We need a question at the end.
We need a question.
So a good question.
You started a trend.
Started trending there.
But I think that's it. Unless there's anything else you wanted to add to your podcast.
No. Happy with.
Yeah.
Got a couple of name drops in there.
Yeah, a couple of name drops.
Yeah,
a couple of shout outs.
Yeah.
We are a bit upset that Stuart and Amy didn't join us, but hey.
Yeah, I hope you're listening to this podcast and we've
got FOMO.
Absolutely.
But thank you for coming on, and thank you for listening.
And we'll see you next time.
Bye.